Another major component of carcinogenesis would be alteration in genes that then evade apoptosis. Remember, please, that in cancer it doesn't want apoptosis. So therefore, let me give you an example as to how it does this exactly. Our topic here brings us to BCL2. Understand that on your boards, you will be quite clear and you will not be able to confuse BCL2 and BCR. One has nothing to do with the other. When I say BCR ABL, you are thinking about the fusion protein 9 and 22, dealing with tyrosine kinase and so forth. It is completely a different discussion. Here, however, BCL2 has everything to do with a translocation called T1418. That chromosome 14 means water water to you, immunoglobulin, heavy chain, and follicular lymphoma. What does that mean to you? Well, this is a lymphoma. If you take a look at historical pictures, would you find the Louis-Sternberg cells? Yes or no? No. So if you don't find the Louis-Sternberg cell, what kind of lymphoma do we have? A non-Hodgkin's lymphoma, one of the many types that we shall take a look at, but quite common, a non-Hodgkin's lymphoma follicular. So what does BCL2 do? For follicular lymphoma, it protects the cell and the cancer cell from apoptosis. In other words, it is an anti-apoptotic factor. You hear what I just said. Language is important. Not pro-apoptosis, but anti-apoptotic. In this box, here with clonal expansion, just a few words here about how cancers like to behave. Clonality, most of your cancers will be monoclonal activity. What does that mean to you? Well, let's take a look. Sex chromosomes come together and you end up forming a female zygote, eventually blastocysts. In activation of one X chromosome, now with neoplasia, what ends up happening is the fact that is only chosen one type here to expand upon. Exactly why? Well, we don't know. Majority of your cancers, in fact, will be monoclonal of type of monoclonality. And in laboratory studies on oncology, there will be certain enzymes that oncologists use or researchers will use to then measure the monoclonality, and these are then called what's known as your isoenzymes. The polyclonal is, as the name implies, will be one in which it has number of your chromosomes. But more common though monoclonality, you have heard of monoclonal gammopathy of undetermined significance. You have heard of multiple myeloma, and those are monoclonal type of cancers.